So we have 4 speakers for you today, one who is on her way, just a little bit delayed. So 3 of our speakers have recently come back from working on the Ebola response. Excuse me. So each of them are going to speak for just about 5 to 7 minutes, just to give you sort of an overview, a little bit flavour of their experience, and then we'll open the floor for questions after that. If there are any media present, we were going to do a separate session afterwards if there's interest. If not, that's fine. We can just do it in this session. So the first speaker is David Weakliam. He's the head of the Global Health Programme he's the lead of the Global Health Programme in the HSE. He's the chair of the Irish Forum for Global Health. Thank you.
Okay, now I expect that most of you know lots about Ebola. It's in the news all the time, but just depending on your source of information, it may not all be correct information, and particularly the media has ways of maybe not always communicating things incorrectly. So just to go over some of the features of Ebola, we thought that would be useful at the start, just at the beginning. And Ebola is a virus. Now, most of us are going to catch a virus, no doubt, over the winter of some sort. So what is it about Ebola that's different about a virus? The flu, the cold, these are all viruses. Well, it's one of a family of viruses that can cause severe disease, hemorrhagic disease. And there's a number of different viruses in that family. So we have now this big outbreak in West Africa. Now, this is the first outbreak of Ebola in West Africa. There have been other outbreaks going back to the 70s. So where did Ebola come from? And it's not entirely clear, but it's likely that the natural hosts of the Ebola virus are fruit bats. And so the virus is existing in the environment, and then it can spread from the fruit bats to other animals. So other animals become infected. And then when animals become infected from those animals, it can spread to humans. And this is how the spread occurs to humans, and then it spreads from human to human spread. So when there's outbreaks, the initial case maybe the virus will have spread to human from animals, but then it spreads between people. And to say a bit more then about the spread, the virus is spread by direct contact with the bodily fluids or the blood or secretions of an infected person. And any of the bodily fluids of an infected person can have the virus in it. A person can also be infected by being in contact with contaminated materials, so things like bed linen or waste materials from a person who's infected. And then important in the West African context, burial ceremonies. So the way in which people handle bodies after death can bring them in contact with the virus. But there's a few things that are important to note about this, that this is not an easy virus to catch. There's sort of a perception out there that maybe that if you're close to someone who might have the virus, you could pick it up. It's not contagious that way. And firstly, it's not infectious before a person with Ebola becomes ill. So if a person comes back from West Africa and they're feeling well, they're not infectious, even if they're in the incubation period. So that's very important. Another thing that's important about it is it's not transmitted through the air. Like other viruses like the flu and respiratory viruses, they can spread through the air. Ebola doesn't spread that way. So worries about sitting beside someone on a bus or a plane and they might spread it to you through the air. They won't, because it's not spread that way. And so the Ebola virus doesn't spread through casual contact. It's spread when people are sick and usually when they're very sick. So the outbreak has occurred, it's principally in three countries in West Africa, and I'm not going to go into the figures, and other people will talk more about the West African context. And we might think of the reasons why, like this is not the first Ebola outbreak, why has this one got out of control? And we might think of factors in the country, about things to do with people's behaviours, maybe around burials, that sort of thing in country, around the response to the government, the capacity of the health system to respond. We might think about the international response, organisations like the World Health Organization, donors, NGOs, etc. There's a lot of factors at play as to why maybe this hasn't got controlled and why the response, it seems, has been slow. But I'll leave that to others to talk more about. To go on then maybe to the signs and symptoms. And Ebola, like other viruses, has an incubation period, 2 to 21 days. The 21 days is very significant because if a person comes back from having been in possible contact, once it's more than 21 days after contact, they're definitely not going to get Ebola. So that's kind of a useful timing to know about. But most people, in terms of incubation, will, if they are developing Ebola, will develop the symptoms within 1 to 2 weeks. And as I said, people who don't have signs of disease cannot spread the disease. So signs and symptoms. Now you do hear in the media people talking about a person coming back, they had symptoms of Ebola. Well, what are the symptoms? They are very general at the beginning. So symptoms of Ebola are the same symptoms for many, many other infections, starting with fever, headache, chills, weakness, tiredness, very non-specific general symptoms. And it tends to come on quite acutely. And other symptoms, gastrointestinal symptoms develop. There are a range of other symptoms. And then it's somewhat later that the more severe symptoms that we associate with Ebola, like rash and the various hemorrhagic symptoms, bleeding, that comes later. What happens then? What's the natural course? We know it's a very serious infection. People die, but many people do recover. And those who are recovering, they will typically have a fever for 5 to 9 days and then start to improve, and recovery then does take a number of weeks to fully happen. The death rate varies, difficult to know exactly because of the statistics, the quality of them. There's lots of data we have from West Africa, but we know that a lot of cases, a lot of deaths are not reported, so we are working on estimates. But the mortality is high, and it ranges from 30 to 90%. And the current outbreak, probably more than 50%. And deaths occur on average about 4 days after hospitalization. And as I said, Ebola, the symptoms, particularly at the beginning, are general, and Ebola can appear like many, many other diseases. And even in West Africa, where the high rates of Ebola are occurring, people who present with the initial Ebola symptoms most likely have something else: malaria, typhoid, other infections. And so when people come back, if they develop a fever or other symptoms, almost certainly it's something else. But you might still have to outrule Ebola because you can't be absolutely sure, but generally it will be something else that they will have. So we don't have very specific treatments. Viruses are hard to treat. There's a number of treatments and vaccines at various experimental stages of development. And the main aspects of managing people is to isolate them so that it doesn't spread to other people, and then supportive therapy with fluids and hydration, etc. And then it needs to be controlled in the population. And this is just good standard public health control measures that would apply to lots of other infectious diseases. So people who have the infection need to be isolated. Its spread is human to human. That chain of transmission just needs to be stopped. Then they've been in contact with people. Those contacts need to be monitored. They don't need to be isolated while they're not infectious. So the guidance in the HSE, for instance, is that if people are possible contacts, they can go back to work. As long as they're well, they're not going to be infectious. But they need to be monitored so that if they then develop symptoms, then they can be isolated, tested, and so you break the chain of transmission. And good control, and there's lots of examples of how in countries where it has been controlled well, are when you make sure that all the contacts are followed up so that you break the chain of transmission. So I just want to thank Dermot. Oh, he's not. Dermot for the slides. Dermot is the lead for training in the HSE on Ebola, and thanks Dermot for helping with these slides and the sources of some other organisations. So just briefly about the HSE response. Our mandate in the health service is to protect our public health, so that's what dictates our response. This was announced as a public health emergency of international concern by the World Health Organization in August. So our response comes under the international framework of the international health regulations. So that requires us to monitor and report on any kind of events in Ireland. In Ireland, the overall risk of a case is low, very low. We've not had any cases. We've not had any people who would be even suspected cases that we thought had Ebola. Some people have had tested just to outrule it, but we've not had any people who were really suspected. And I saw this term from someone from the United States talking about their response, and he used the term an abundance of caution. And I thought it was a nice term because it was being used to describe doing things that were actually totally unnecessary, but were done because of sort of the political pressure to be shown to be really doing something. But I think it does apply in that I think in Ireland we are adopting that approach with an abundance of caution. We are doing an awful lot of measures to try and to make sure that if there is a case in Ireland, that we're prepared and that we have responses so that it doesn't spread in Ireland. And that's twofold. It's about, first of all, about detecting, diagnosing, and managing possible cases. So all sorts of guidelines, algorithms, protocols, everything you can think of to deal with possible cases at every level. So for people at seaports, airports, for people in primary care, in hospitals, ambulance service, you name it. There are guidelines in place so that everybody is prepared. Infection control procedures, lots of guidelines about that. And in Ireland we have a national isolation unit in the Mater Hospital. Then preventing secondary cases, again, lots of guidance and preparation around if there is a case, how do you prepare, how do you manage and follow up contacts. Infection control, very central to this. But this is not new. I mean, the hospitals are dealing with infectious diseases all of the time. They know about PPE, personal protective equipment. They know about infection control. So this shouldn't be so complicated to do if needed. And just to show you quickly about these algorithms, just to show all the kinds of things that are developed, lots and lots of discussion about how to have all these algorithms. This is for GPs. There's another one for the ambulance service. There's another one for hospitals, and they get more complicated as you get down into different levels of care. But worked out very closely, and a lot in this about communication. Who do you contact to get the right information in order to make the right decisions? So last slide, just to say about, well, what should the HSE or the health service do in terms of support to West Africa? I mean, our mandate is healthcare in Ireland. And I would say we should respond, and on two grounds. Firstly, on humanitarian grounds. I mean, this conference is about partnership, and we talked about global partnership for development, which is about how all countries should work in solidarity to help address health needs in low-income or less developed or more challenging countries. And so I think we have that responsibility as part of Ireland's overall response to what is a global health emergency. But the other aspect of this is that we should respond in Ireland to support the response in West Africa for our own health protection security. And I think in Ireland sometimes we think of, well, if we're going to protect ourselves, let's do lots of things in Ireland. But actually, the best thing to do is deal with this at source. If we want to protect the country, let's deal with this in West Africa. And so I think there's a good basis for our own health protection for us to be involved. How do we do that? We obviously need to partner the health service with other organisations, the Department of Foreign Affairs, with NGOs, with WHO, etc. What can we do? We can send personnel, and we have people here from the health service who will speak now after me, who have been out. And there will be other health service personnel who will go out. We have people with skills. That's critically needed at this point. It means there's been lots of funding, material, resources put in. There's a big need now for people with skills, both local personnel and international personnel. And then training. And one of the roles that people in the health service can play is to support training for those who are going out. It's very important people going out are well prepared, that when they go out they're able to work effectively and they're able to work safely. So I'm going to finish there.